Ohio ranks sixth in the country in population age, according to the Ohio State University's College of Medicine. The US Census Bureau, which has full pages and sections that are not accessible or updated because of the federal shutdown, says about 1 in 5 Ohioans are over 65. The graying of Ohio's population means there's more attention and potentially more money going to programs to help people with complex medical needs who want to stay in their homes longer. The state is expanding the Program of All-Inclusive Care for the Elderly, or PACE, which started in Cuyahoga County and expects to be operating in 10 counties by early next year. I talked with Ohio Department of Aging Director Ursel McElroy about what PACE does. So let's talk about the Program of All-Inclusive Care for the Elderly, PACE. The goal is to provide all-in-one care for Ohioans who have complex medical needs and require nursing home care. Started in Cuyahoga County, plans to expand to 10 counties by early next year. So what does this program actually do, and what does it look like in action?
Absolutely. It is what we call an integrated care model so that the individual can receive all of their services in one place. Can you imagine going to one place for all of your therapies, your medical appointments, your medication, and just your socialization? All of those things can happen in one place for an individual versus having to go to multiple providers.
And the goal, again, is to keep people in their homes and in their communities. But obviously, there are people who are in this program who need care that goes beyond what they could get in their own home from a home-based caregiver.
Absolutely. And so many of these individuals go to what's called one of our PACE centers. And it's a really lovely thing you have to see. The individuals receive transportation at no cost. They arrive at the center. They can have their meals. Some centers even do things as deep as laundry for individuals. Again, all of their therapies, all of their counseling, all of their medication, all of their needs are there. They meet new friends. And the great thing about it is that those caregivers that perhaps the individuals may live with can go to work, continue to contribute to our economy, and do so knowing that their loved one is safe.
So it's kind of like a senior center, but has other benefits that go well beyond just the socialization and that kind of thing.
Absolutely. And those individuals who go to those centers have the option to have the full panoply of services often provided through their Medicare benefits and in some cases their Medicaid as well.
And the facilities that the program is set up in, what are those facilities? Are they brand new? Are they facilities that have been rehabbed? Can you tell me a little bit about those?
Right. I think it varies. And that's the exciting thing about this here in Ohio. Not long ago, we had one PACE provider in the state, and the PACE model was offered in the Cuyahoga County area and some of the surrounding areas. But since we've been able to move this program forward, we now see that it will take off in greater than 9 areas across the state of Ohio, and we're really excited. In fact, I think it's perhaps close to 10. And many of these sites, some have been new builds, but others have been rehabbed facilities or structures that we were able to repurpose.
Who qualifies? Who qualifies for this program? How many people do you expect will be served once it's expanded to the 10 counties? And how do you qualify? Can your caregiver qualify? Make sure that you're qualified or check to see if you're qualified?
Absolutely. Absolutely. So if an individual is 55 years and older, if they have nursing facility level of care, you can qualify by a variety of different ways. One, there must be a PACE site obviously within that area. But in addition to that, you can pay privately. You can pay through Medicare, and also you can pay through Medicare and Medicaid. So it is a very, I would say, diverse opportunity for people to take advantage of. And so I wouldn't make the assumption that I didn't qualify. Again, it's more so if you're 55, if there's a PACE site in your area, and you have that nursing facility level of care.
How do you know the difference between you could qualify for PACE because it's near and it's in
Correct.
your county versus you really need to be considering going to an institutional setting, a nursing home?
Absolutely. I think that's a question that many individuals and family members grapple with. And I always say try to start with the least restrictive option, or the option that most suits that person's needs and or preferences. And so oftentimes there's what's called a level of care assessment done. And with those assessments, the options for that family should be provided. And so based upon that assessment, if it is determined that you can be safely served at a PACE site, that's an option you might want to consider. There may be circumstances where, in fact, maybe a different type of care option is more suitable. But we certainly want to be sure that that assessment is done, that you have your questions answered, and that you're in the most appropriate setting.
Certainly, you do have people who are going to need the longer-term institutional care. Is this a more cost-effective option for the state, for the federal government, for individuals to seek out PACE if it's available versus going to that institutional care, that nursing home?
Right, that's a good question. This is what we call one of those integrated care models. And with these models, the idea is that if an individual, say for instance, has both Medicare and Medicaid, how can we maximize those benefits at the most affordable cost? Oftentimes there is a capitated payment model, whereas we know that only up to a certain point will we have to pay when in fact there are public investments in this model. So again, I think it depends on the person's needs, what that care plan will look like. But this is a model where we do have some control of the costs because of the capitated payment structure, and it is integrated. So we have the opportunity to have, I think, a more cost-effective model than perhaps some others.
Now, with the expansion, PACE would be in the most populous counties in the state, which makes sense. But you have need throughout the state, especially in rural counties and Appalachian counties where you have an older population. How did you decide to go to these 10 counties, and how do you broaden from there?
Absolutely. So there were a few things. Number one, we had a market analysis done. So we worked, in fact, with Scripps Gerontology Center to help us determine where's the market most saturated and where will the needs be. And so we looked at a variety of factors to help us come up with that. And then the General Assembly also had great interest in this model. And so we were given guidance from the General Assembly by which counties we would want to start with. But what we were pleased with is not only did that guidance align really well with the market analysis, it also gave us opportunity to emphasize a rural PACE. And rural PACE centers are perhaps one of the most challenging places to have a PACE center. But the interesting thing is they're probably one of the places that have one of the greatest needs for it. And so we're very interested to see how one of our providers is able to thrive in some of our rural settings.
And when you're talking about rural settings, obviously you're talking about transportation issues, you're talking about maybe technology. There's lots of things that I guess you have to consider with all that.
Absolutely, particularly the transportation. And I think that's it, making sure, one, that we have enough people in a concentrated area and being able to transport them back and forth within a reasonable amount of time and to do it safely.
And you've got a workforce issue there as well when you're trying to make sure that enough people are there to serve the population.
Absolutely, but it's interesting you bring up workforce because that's again why the PACE model is so amazing. Because if you have most people come into this setting where they can, one, have the ability to socialize with people, be able to thrive and have all their needs met, we can do it with a lower overhead cost because everyone and everything you need is in one place.
So kind of an economy of scale there.
Absolutely, absolutely.
I want to talk about cost again here. I mean, this is a federally funded program through Medicare and Medicaid. It's available around the country.
Yes.
If the federal shutdown happens and continues, well, it's happened, if it continues, what does that do to your expansion plans? Do you have plans in place to try to deal with that?
We absolutely do. I believe at this point we're on track with pretty much everything to open and to go to continue to move smoothly. At this point, the department feels really confident. We've looked at our cash flow. We looked at things that are continuing to happen. Certainly we're keeping our eye on things, but at this point we have no reason to tell people to panic, no reason to feel that we'll have to discontinue or to disrupt any services.
And how much does this cost the state? I mean, again, you talked about the funding model here.
Absolutely.
How much does this cost the state?
Absolutely. So I think the first thing to point out is the PACE model for a long time historically, when it came on the scene back in the 70s and it was formalized in the 90s, was pretty much taken up by just not-for-profit entities. And now, I would say like in 2016, the federal government allowed some of the for-profit entities to now come into this market. With that, we've seen some interesting things. I think first, one of the things we found with PACE centers is that you really must have the capital investment to be able to open these centers at the beginning. And so having that mixture, I think, will help us balance that out a bit here in the state of Ohio. also we were able to have a one-time investment upfront of $50 million right before the 24-25 biennium budget, which really helped support these particular providers in making the decision to open up in our state. And I can tell you it has caught on. There are providers from all over, and certainly our Ohio providers, but even outside, that are interested in breaking into this market. So I think we're going to be just fine in that regard.
There's been a lot of criticism over the years of nursing homes and how nobody wants to have to seek out that option, though it is necessary for some folks.
Absolutely.
Do you think we are close to this idea of you can choose whether you're going to go to a nursing home or whether you have other options? I mean, staying at home is really what most people say they want to do.
Absolutely, absolutely. I think what's been important to me, and I think the entire aging network, is that no matter where you are on that continuum, that we have high quality service. And for us, that means both quality of life and quality of care. So it is both clinical and those other things that really make living enjoyable. What you eat, having people around you, the things that you want to do. And so I dream of a place where in Ohio, if your desire is to stay home and receive care, you will be able to do that and do that safely and with high quality care. If in fact your situation is one by maybe having an institution or maybe having a facility setting where you can have that 24-hour around the clock is what you need, we still want that to be of high quality, both in care and quality of life for those individuals.
The cost of all this obviously is, the cost of aging in general is immense. And your agency got an increase in the 2-year budget, but you're addressing issues that have a lot of cost. And let's just, for example, Alzheimer's. Estimated to cost $360 billion nationwide last year, projected to exceed $1 trillion by 2050, which is only 25 years away. Do you, as Ohio's population gets older, the age 65 and older is the fastest growing portion of Ohio's demographics. Do people have to just kind of be prepared for this is going to be expensive? This is going to be a part of the state budget that is going to need a lot of attention.
I am so glad you brought that up. So it's interesting, when I came into this role and I had a chance to see where the Department of Aging sat within the entire HHS infrastructure. And I think that perhaps its size is a little misleading. I think that it is a very agile organization. I believe that it has run on very thin margins and has done so successfully. However, I think it is really important that if we are going to be strategic and look at the large demographic shift that not only Ohio is facing, not only the U.S., but the entire world is facing a huge demographic shift, that we must appreciate what that means for our economy and our health care, amongst other things. And so I think the question is, how can we provide what we know will be needed, but do it at the lower cost? A lot of this does mean doing things sooner. It is my observation that many of the things we've done, while effective, have been later. If we can do things upstream, if we can pay for lower cost services that help people to stay independent sooner, if we could do things in a manner that don't necessarily wait until you are your sickest and sometimes your poorest, I think that is going to be key, because the population, in fact, is growing. It is aging. And that's not anything at this point that's going to change anytime soon. But our strategies, our planning, and making sure that we're prepared, those are things that we can control. And I really would love to see us really take a really hard look at that and see that as a very strategic effort in line of business within our state budget.
We all say we want to get older and live the biggest, longest life possible. There's a lot to consider on that.
Absolutely, absolutely. We do have, I would point out to you, there is a state plan on aging. Every state must have, and we must submit it to the federal government. And within our state plan, we do contemplate these things. We contemplate things that individuals can do themselves to begin to prepare. We also look at the things that we can do as a state to prepare for this large population that's just continuing to grow. And along that growth, I do want to make one last point. It's not just about those who are 60 or 65 and older. It's also looking at within that group there are a large number of individuals who are 85 and older, and with that brings another level of complexity because there's increased disability. So it is not just that number, it is also within that number what we should be concerned with.
And even the number below that, the people who are providing the care, the caregivers, the family
Absolutely.
members, all those folks are part of this whole discussion as well.
Absolutely.